What's up, everybody? My name is Pauline and I'm a physical therapist and you are watching Clinical Sprinkles. So I had to wear my Physio Memes shirt. It says Make Life Humorous because today's episode is going to be a little bit more on the fun side. This was an idea brought up by someone on my Instagram, and he suggested that we go over some funny PT stories. My first year out of PT school, I worked part-time PT in an outpatient clinic, and then once I passed my boards, I transitioned to full-time PT, and even on top of that, I wanted to make more money, and so I actually signed up for a PRN job at a skilled nursing facility, and so I was kind of on this list that, they'd send weekly of like, these are the places that need coverage, this is the amount of hours that you get, and so I signed up to work on the weekends because I already worked Monday through Friday at my outpatient clinic. So I did that PRN job for, I don't know, maybe 4 to 6 months or something like that, and worked probably 2 Saturdays a month, and I got burned out. I mean, working 6 days a week, and then, when you work 8-hour days, but you make like really good money. I just would have had less time with my husband on the weekends, and I just got burned out so fast, and I was like, wait a minute, I'm only in my first year of PT school. Why am I getting burned out? Like, why am I doing this to myself? So I ended up stopping that job. But why I brought that job up was because when I worked at that skilled nursing facility, there was one location that I really liked going to, and at that location, there was actually, I think he was an occupational therapist that was the director there, and he had this like book where he would put funny stories in it. And so I guess like he told me that when they were having like an off day, a slow day, or like, I think it was like a rough day for the clinic, they'd refer to this book, and it would just have funny quotes or funny moments or notes that they'd look back to and just kind of laugh about it together. And I thought that was such a cool idea that I immediately implemented it at the outpatient clinic that I was working at. So here's my book. Of course it's pink. It's been at least 3 months since I've looked at this book, and so anytime something funny happens, you write it down. Sometimes you revisit a few pages, and I highly recommend keeping one of these books in your clinic, in your practice. Of course, make sure it's HIPAA compliant. You're not writing people's names down. You're just writing the quotes and maybe something that, sets the scene, like maybe the demographic is important for it to be funny or something like that. You can add that stuff, but still make sure that whatever you put in your notebook is HIPAA compliant. Okay, I'm so excited to delve into this book. Okay, anyway, let's open it. It starts off with me taking some notes for like an online class I was taking, I guess. So I think it started off as like a PT notes, like I wanted to take notes on this really important thing, and then it ended up being this like quote book. So make sure you stick around towards the end. I share my favorite, most funny story. I kept some post-it notes in here that my coworkers had left for me. Here's one of them. This is my nickname. It's Amy Tranister Pants Slayer. So there's an inside joke with this, of course, and so Amy is my middle name. Tranister is because we were watching Game of Thrones, and then Pants Slayer because I ripped my pants all the time. I was wearing like nice express slacks to work all the time, and when I was showing exercises like jumping lunges or this stretch that you have to get on the floor, I kept ripping my pants, and so that's where this name came from. Rude. But now I wear Lululemon pants. They're called On The Fly. Highly recommend. They look good, they let you move, and they're super comfortable. I wear them all day, and I could wear them outside of work too. I have them in 4 colors. That's how much I love them. I love them. Highly recommend them. I'll link it in the notes below. Okay, so I'll just like randomly pick one. So I guess this one time I was telling a patient that icing is good for his condition, and so I said, icing is your friend, and he says, chocolate icing? Oh, okay. Asked a patient how he's doing, and he replies, I've got bad news. My pain is less and was not present for 2 days. And I said, that's bad? And he said, no, it's that you don't get to see me anymore. Okay, so this one was from someone who was in 6th grade at the time, and I was working with her, and we both had Fitbits at the time, and we always compared our steps. It was like a thing that we did. We just compared our steps. In clinic, in outpatient ortho, I'm on my feet a lot, but I'm not like walking back and forth, so I'm in place like doing something with someone. So my step count is usually really low, whereas she has like recess, and she's doing all these things, and she's on her feet. Anyway, so we compared our step count, and she had a lot more than me that day, and so she was just like, oh, well, did you do sports in high school? And I was like, yeah, I did tennis. And she said, oh, well, how many steps did you get then? And I thought, it was like, I didn't have a Fitbit then. Fitbits weren't a thing, 10 years ago. And for her, she was like, oh, that's weird. I hope these are funny to you guys, because I mean, like, when I read back on these, I think of the patient, and I think of that memory and the way the patient said it, and so they're really funny for me, and they make me really happy. And so when you guys make your book, which I highly recommend you do, that you'll look back and you'll think yours are really funny as well, or just give you back, like, I don't know, they just make you feel good. Okay, so we were getting ready to do a rotator cuff exercise, and I had a student at the time, and the way that she described it was, okay, we're gonna use the little muscles of your shoulder, because your supraspinatus, your rotator cuff muscles are relatively small. And he looked at me after she said that, and he said, she just called my muscles little. Our PT aide said this to a patient. He said, are you ready for your dumbbell exercise? And she said, why did you look at me when you said dumbbell? I asked one of my patients what his favorite thing about owning a business was, and his answer was money. Of course, why else would you do it, I guess. So I had this guy, he's over 65 years old, and we were just trying to find a different way to get some cardiovascular exercise for him. He is not fond of going on walks very much. And so he had ridden our bike in the clinic for 5 minutes, and he liked the bike. And so I was like, okay, maybe you should get a bike. He's like, oh, great. So then he ordered a bike, got it shipped to his house, had it assembled and everything, and he was so excited to tell me about it. And then I told him, I asked him, I said, how long did you ride it for? And he, just so proud with his arms crossed, he said 2 minutes. And then I said, oh, good. Maybe you can increase it, a few increments at a time. And he's like, I did. And I was like, so how long did you ride for? He's like, 3 minutes. And I was like, great. Well, maybe someday you can build up to 15 minutes. And he was like, that many? Okay, this one was probably a favorite amongst my coworkers. And if you look back at it, and I promise I dealt with this super professionally, and I was totally, I kept it together, no laughing during, but then you laugh after the fact. So anyway, the patient, he sat down, he was in clinic for his shoulder, he sat down, he was like, my MRI says I have a supraspinatus tear, infraspinatus tear, and a labia tear. I just replied, you mean labral tear? And he said, oh yeah, that. And I was, if you don't know what labia is, yeah, I wouldn't Google search it necessarily, but it's a lady part, and the patient was a male, so let's just leave it at that. So those are a few of my funny stories, and remembering them off the top of my head would have been a tough task. And honestly, it's like having a place to go to when you're having a rough day, something like this, it just reminds you of all the really sweet, funny patients that you've helped before. And so I highly recommend you starting one of these books. Again, make sure it's HIPAA compliant. I don't want you to get in trouble. I don't want to get in trouble for telling you to write this stuff down, but just keep it in general context, because even looking back at this, some of these are 3 years old, and I know who the person is. I remember that moment, and because I revisit this book every once in a while, that memory stays fresh, keeps me motivated, and just makes me really appreciative of the job that I have and my ability to help people. and stay really positive when times get really rough. Also, if you're not already, please check out my Instagram page. I also post some information on there, some things that I don't share here on my YouTube page. And then also I have a website, it's called clinicalsprinkles.com, and there I share some services that helps PT at different levels. I help pre-PT, I help student PTs and current PTs through different realms of aspects that may help through professional growth. So please check it out. Let me know if you have any questions. Thank you guys for watching another episode of Clinical Sprinkles. If you guys have any questions or comments, please leave them below. Otherwise, subscribe to my page and click the bell so that you guys don't miss out on future episodes. So yeah.